And we're live. Hello, everybody. It is registration time for our presentation. We are going live tonight on several different platforms. I'm Christy Bigham, Future Executive Senior Sales Director with Mary Kay, and tonight we're going to hear from a guest speaker, Dr. Ashley Sturgeon. We'll be hearing from her in a moment, but we want to say welcome and hello. We want to get you commenting tonight, so go ahead and comment for us to let us know that you're here. I'm going to turn on the comments, and I'm going to make sure on my phone that our technology is working on our different platforms. So if you're coming on, give us a comment. We want to know who you are. Please put I'm a guest if you're a guest, because there are several beauty consultants from different groups that I may not know if you're a consultant or a guest. And also a little bit of housekeeping. If you're watching us on Facebook Live, go ahead at the top of the broadcast. At the top of the broadcast, there's a message that says allow StreamYard, or I believe it says grant StreamYard permission to see your name. Would you do that? Would you grant StreamYard permission to see your name? It filters all of the names into my one streaming system so that I can give you a door prize tonight. And I know you're going to want to win some of the door prizes. So go ahead and make sure you do that. Little housekeeping. I am going to make sure our technology is working, and yes, it is. It definitely is working. So welcome. I'm Christy Bigham. Welcome to the many different platforms that we're broadcasting from tonight. We're broadcasting from Facebook Live on Cosmetics with Christy and Friends. We're also broadcasting over to the My Mary Kay with the Mindy Gray group. So welcome to the Mindy Gray group. And we're broadcasting to the virtual beauty sessions with Lonnie Marie and her Diva group. So welcome to Lonnie Marie and her group. And we are also broadcasting to I Love My Mary Kay, the Dee Russell group. So welcome to Dee's group. So don't forget a little housekeeping item so that you can be in our drawing for our hundreds of dollars of door prizes tonight. At the top of your live stream, there is a message that says grant StreamYard permission. Grant StreamYard permission to share your name. And if you would do that, it's going to tell me who you are in my streaming software. Let me see if I can put that up on a banner so y'all can see that. Grant StreamYard permission. I'm going to put this up here so y'all can see it as you come on. I don't have to keep repeating it, hopefully. Let's see if I can get that up there. And the rain is coming down at my house. And a little hail, too. Oh, goodness. I wonder if Dr. Sturgeon's husband has planted yet. Has he planted?
No, not yet. He didn't start today, but he held off, so maybe tomorrow.
Good. So, again, between 7:05 and 7:15, we are just saying welcome to you as y'all come on. Our presentation is going to start at 7:15. I hope this hail that you can hear on my roof is not making too much noise. Dr. Sturgeon, can you hear it?
I can hear it, but it's not that disruptive.
Okay, good. It sounds like a hurricane in here. Wow.
Yeah, it's not too bad.
I think everybody's going to need a new roof after tonight. But anyway, welcome everyone. We're glad that you're here on Cosmetics with Christy and Friends and the other Facebook platforms. We have a treat for you tonight, and we will be getting to our guest speaker in just a moment. Go ahead and tell us who you are if you're a guest, and make sure that you go on to the top of the broadcast where it says grant StreamYard permission. We would love for you to grant StreamYard permission to see your name. Let me get my microphone a little closer to me so that I don't have to yell over all of this. Okay, so let me say some hellos. It is 7:15. I want to say some quick hellos, and then we're going to get started. I do see Brenda Thomas. Welcome, Brenda. A few others have not granted permission yet, but I see some people saying hello, and they're saying hello to Dr. Sturgeon already as well. Jennifer Taylor, welcome. Glad you're here. Julie Goodglow, glad you're here. Joanne Bigham, welcome. Tiffany Parsley, welcome. And many others of you are coming on saying hello, but you haven't granted permission yet for me to see your name. So make sure that I can see your name. What, Madison? Okay, so where to grant permission, you guys, is up at the very top, right above where this broadcast is going on. If you're watching on Facebook Live, it'll be right above my video, right above where you see my face. It'll say, I'm going live with StreamYard grant StreamYard permission. And you just click right there. It's super easy, and you can grant permission. I see Christy Schmidt. Hello, Christy. Hello, Stephanie Goldston. Welcome. Many others saying hello and hi, even though you've not granted StreamYard permission for me to see your name yet. I want to make sure I see your name so that you can be in the drawing for our door prizes tonight. Okay, so now that we've said welcome, what do you say we get started with what we came here for tonight? You guys are in for a treat. If you are not aware, May is Skin Cancer Awareness Month. I almost said skin care, but it's Skin Cancer Awareness Month. And what an important thing to be aware of, because so many people don't even realize that skin cancer can be so serious. And we are so lucky to have with us tonight the most beautiful, the most wonderful, the most talented, smart dermatologist and skin surgeon in all of Lubbock, Texas, Dr. Ashley Sturgeon. She was so kind to come speak to us 2 years ago, and by popular demand, she is back. So tonight, she's going to share with you her presentation. She calls it Skin, the Good, the Bad, and the Ugly, and we're going to hear it all. She's going to share with you some of her favorite ingredients. She's even going to share with you how she first became connected to Mary Kay Cosmetics, which is my very favorite part of her story. So I want to tell you a little bit about her. She, of course, works at Texas Tech Health Sciences Center, and she is the surgical director there. She is a board-certified dermatologist, surgical director there at Texas Tech, and the procedural director. In other words, she teaches people how to do all of the things they need to do as dermatologists and as skin surgeons. She's also the assistant professor of dermatology. And so she's very skilled in teaching and working with clients and working with patients and helping other doctors learn to do what she does. So she's a great person to rely on and hear from. I want you to know that also she has several surgical fellows that have joined her over the next few months, and she can tell us more about that. And they do a clinic on Friday afternoons and are always looking for people to come in and see what they might need and see how they might can help you. These fellows need to see patients and learn on real live patients and practice the different procedures. And so she can tell us all about that as well. So without further ado, let me introduce you to my friend, Dr. Ashley Sturgeon.
Thanks, Christy. You're too sweet. All of that is very nice. This is fun for me to do. So as you know, but others may not, I was a consultant back in my college days to make some extra money while I was studying to get into medical school. And so my mom was a consultant. I have 4 sisters, and so she stayed busy providing us all with skincare. I think she probably got all her credit just with us. But I did learn a lot about skincare at an early age and was very interested in dermatology. And so it was perfect for me in the dorm to make a little extra money and help other women discover what they liked with makeup, especially. So we had lots of fun with that. So this talk is dated May of 18. I cannot believe it has been 2 years since I've done it. We've got to do this every year, Christy. It's too fun. But we'll get started here. So the good, the bad, and the ugly of skin cancer. So let's next slide. Thank you. Perfect. So this was my counter in 2018 where I had unearthed velocity. So if you have been with Mary Kay for me, like when dinosaurs roamed the earth, there was this line called Velocity, and it smelled wonderful and nice citrus, and it was marketed towards like teens. And this gel moisturizer was so nice, and I love it. And so I hoarded it and was still using it like 10 years later. So I don't know when they got rid of it, but I had had it for quite a while, and it was wonderful. So I thought that was funny because when Christy asked me to do this talk, I had that on my counter. So I thought that was cute. So thank you. So I will start with this because I wanted to start with some things that I get asked about in my clinic every day. And so these things, people will tell you that they just bump into any old thing and they don't even remember what they bumped into, and they get these brown or purple or red spots. And these are bruises, but they come because the collagen in the skin has worn down because of sun damage. And so you won't see these on people's rear ends, but you will see them on their forearms especially. And some very sun damaged legs will have them as well. And there is absolutely nothing but a time machine that will fix these. There are some products that are known to help with bruising. A holistic product called Arnica is helpful for these, some people say, but I don't really know that it is. The retinol products may be helpful also because they help to rebuild collagen, and we'll talk about a retinol product that Mary Kay has in a moment. But it can get a little pricey to use retinol all over your forearms, but some women really, really hate these and might find it worth their money. So I do recommend retinol creams for this. But I do tell patients with a caveat that really nothing but a time machine will fix it, but a retinol cream might help you. So yeah, next slide, Christy, thanks. And so these things are dreadful. People hate them. They start coming up in your 40s. They're called seborrheic keratoses, and they're scaly, they're waxy, they look like someone maybe stuck some brown gum on, and they're absolutely harmless. They do not turn into skin cancer. They are not melanoma. And my partner, Dr. Tarbox, always says when she gets to heaven, she's going to ask God why he made these. But I know the answer because these scare people. And I'm so thankful because people will come in scared about these, and I will find inevitably another skin cancer on them that they didn't even know about. So I'm thankful for these ugly things because they are mixed blessings. They'll bring patients into the clinic sometimes. But if a patient asks you about them, or patient, I guess they're clients for you, but you know, always direct them to a dermatologist because rarely melanoma can look similar, and sometimes it can get them in to help me find another skin cancer that we need to take care of. So yeah, next slide. Oh yes, wrinkles. We'll talk so much about these. But I think it's funny, this quest for never-ending beauty and no wrinkles drives us a lot of places. I had my residents over lunch today. If you see any blood spots, swelling, or bruising, do like $1,500 of work on me over lunch. So I'm a little hazardous looking at the moment. So I'm glad that the screen blurs it a little bit. But we're always in search of blotting out the next wrinkle. And so next slide, we'll talk more about that later. So sunspots, these are, some people will call them liver spots. They are friendly. They do get worse in the sun. And so sometimes you'll hear people say things like, I'm going to tan so my sunspots will get better. But that makes absolutely no sense. It does not work. All it does is blur them and actually make them worse. So what happens is the skin tries to protect itself from the sun, and then it gets darker and creates the melanocytes, help make pigment in the skin to protect it from the sun because it feels like you're going to assault it with sun again. So more sun goes on there. So anyway, they're friendly most of the time, but there is a kind of melanoma that can look like this. And so anyone who grows sunspots, I think, is probably worth getting a skin check. So sign of sun damage. All right. Oh, varicose veins. I get asked about these a lot, and this is the time of year where people ask me to treat them. But the best time to treat varicose veins with sclerotherapy is actually the fall, because you have to wear compression socks all the time after you get it treated to help the little vessels shut down. And so what I do is I inject a tiny, tiny needle into the vessel to make the vessel close down. And so you can't see it on the surface of the skin. It only works on the tiny vessels. Once you get those deep, spongy ones, it really doesn't work very well. And so sometimes I'll have patients who are disappointed because we can't get that fixed. Really, it takes a surgeon to go in and cut those veins out. But I do sclerotherapy on many women once a year in the fall. They come in every year just to kind of get things cleaned up. And it's a nice procedure that we charge about $300 for. It does have to be done every year or two. Because those veins fill back up as long as you're on your feet. But I wear compression socks all the time. Even just a little low compression is very nice. You don't have to wear the hose. They can be so expensive, but just a nice sock is really helpful. I've got some very unattractive ones on at the moment, but I never take them off really. Okay, next. Thank you. Okay, so this is what I do a lot of my day, is freezing these precancers off. And so what there is right in front of that guy's ear, there's a little scaly spot. And you might think it looks like a seborrheic keratosis, which has the same last name. But remember, the seborrheic keratoses were friendly. And this is an actinic keratosis, meaning coming from the sun. And these are precancerous. They're not cancer yet, but it's good to freeze them off when you see them, because 1 in maybe 1,000, we don't really know the conversion rate, will turn into a skin cancer. And so better to get rid of those early. We freeze a lot of those off out here in West Texas. Okay. Basal cell carcinoma. This is what's going to put my son through college, because these spots are often pearly, described pink spots, and can look really different. There's a lot of different looking basal cells, but the classic thing that someone will tell me is, oh, I just thought that was a pimple, and it didn't go away for more than 1 month. So anything that's not healing in a month needs to be evaluated by a dermatologist. And so I'd say that's the classic line that, oh, it's just a blemish, and then we biopsy, it ends up being a skin cancer. These do not go to other organs. They very rarely kill people, really only when they are not treated. But surgical excision fixes these. We trade you for a scar, and you go on with life, and they're very okay to have. And in fact, this is the most common skin cancer in the world. It doesn't even affect most health insurances. It's so common. Back in the days when we had pre-existing conditions, you could put basal cell and insurance really didn't even care because it wasn't that dangerous. But that being said, it can be disfiguring. And so seeing a dermatologist can help you catch it really early and give you the smallest scar possible. So let's go to more bad. Yes, this is the squamous cell carcinoma. It's a little worse than basal cell, but not as bad as melanoma, and it comes from a different cell in the skin. So the top layer of the skin, called the epidermis, has 2 main types of cells, and it has squamous cells and then basal cells at the very bottom base layer. And so these 2 cancers come from these 2 different cell lineages. And so squamous cells can go to other organs, they can kill people, but it's pretty unusual. Most of them we just cut out like basal cells, trade you for a scar, and move on with life for these as well. Okay. Yeah, melanoma is definitely one of my least favorite. It's a bad actor, and we talk about these things. These are all pictures of melanomas, and you can see they all look very different. But A is for asymmetry, so they look different on one side than another. They may have an irregular border, and so I always say that a scalloped border is pretty on a dress, but not on a mole. And so the colors, many different colors are often seen, and bigger than a pencil eraser. So there are moles that you can have from birth. Many people do that are very large, and those tend to be friendly, but melanomas evolve as well. So we added E to the ABCDs a few years ago, and anything that's changing, sometimes they don't look that bad, but they're just changing, so we take it off of a patient. So melanomas, when caught early, are not that dangerous. I can cut out a melanoma at stage 0 with a 95 to 99% cure rate. And so all you get is a big ugly scar and you're done. But if melanoma is more invasive, of course, it can be quite deadly. So I spend a lot of my life taking off moles and trying to rule out melanoma there. So now I'm going to show you the best anti-aging cream in the entire history of the planet, which is sunscreen. And so it doesn't matter what you're using. If you are not protecting your skin from the sun, you are causing oxidative damage every day that makes wrinkles. And so I love these sunscreens. The one on the left, Christy has given me to try, and I used it today. It's very nice. It's got a nice, elegant feel, very light, and goes on well under makeup. So I love that. I love that. And then to get the extra anti-aging, I just wanted to say that one on the right, the Voluform, has a hyaluronic acid in it, which is really great stuff that helps moisturize the skin very well. We actually inject hyaluronic acid into people as filler, and I'll talk about that more in a minute. So it's a very good product that helps. What hyaluronic acid does is it attracts water, and so it helps to make the skin look more moisturized and fill in those wrinkles. So, okay. Oh yes, what about vitamin D? And so this one popcorn is saying to the other that I told you to put on sunscreen, and so the other popcorn is popping because it didn't put on sunscreen. So what about vitamin D? Vitamin D is necessary. And so we know that it's very important for many functions in the body. And I think we're still learning a lot about what vitamin D really does. Helpful with bones. We do know that vitamin D deficiency can cause hair loss. And so I check vitamin D on a lot of my hair loss patients. And I think what irritates me is that the universe tells you that you must get vitamin D from the sun, which is a big old pile of baloney, because you don't have to get vitamin D from the sun. You can absolutely get it from a good, healthy diet or calcium with vitamin D, which many women need to be taking anyway for their bones to prevent osteoporosis. So I don't worry about vitamin D. I'm obviously the same shade as a vampire, and I think it's great. It's great to take it as a vitamin, and it's good to eat cheese and yogurt and fortified things. Salmon has a lot of vitamin D. But most women should be taking vitamin D and calcium anyway, so you do not need the sunlight to exist. There are types of patients who actually get skin cancer very easily from the sun, and they can have perfectly normal vitamin D levels with supplementation. They do not have to have sunlight. Okay, so here's 4 people that can, well, actually it's 3 people. So the lady in B and C is the same person, just from the front and the side. And so I'm going to talk about what we can do for these people. And procedurally, the young lady in A is fantastic. She doesn't need anything, but she can get preventative Botox. And so when I say that my residents did $1,500 worth of work to me today, $1,200 of it was Botox. And I think that it's really, really useful to do preventative Botox. I think my face moves just fine. I think I can emote and express things. So I think Botox in the hands of a talented physician who's core surgically trained in cosmetics, like dermatologists and plastic surgeons, are very good at making sure that you have a nice natural effect with Botox. And so she could get some benefit from a little bit of Botox. The lady in B probably needs Botox plus fillers. And so she could get some of those hyaluronic acid fillers. We can inject the HLA, we call it. This is a product like Juvederm, maybe you've heard of. There's several brands. Juvederm is probably the one by Allergan most promoted, but there are many, many good brands of hyaluronic acid. And they can be injected pretty safely, again, in the hands of someone who is well-trained. And then in D, I would say this lady is beautiful, but she would not benefit from Botox or fillers, and they're not going to help her. I would do a deep laser for her, but I have what I call facelift sign. And so if you have to physically lift the skin to make it look better, you need a facelift. And so we've got some awesome plastic surgeons in towns who are in for that sort of thing. And so I encounter patients all the time who have little interest in doing facelifts, and so we'll try to help them with procedures that can augment their appearance without having to go to surgery. And that's really where I stop. So if it requires surgery for cosmesis, I send them to a plastic surgeon. So, okay, yeah, next slide. So this is me with frighteningly little makeup. I think it's like day-old makeup before I ever had Botox. And so Botox is for movement wrinkles. And so you can see I have lines across my forehead there. This is actually when I was 24 years old. I'll tell you more about that later, but I'm a very expressive person and have lots and lots of movement in my face. And so I started getting Botox when I was 24. And this is when I was 24 before I ever had Botox. And this is me today, after like I'm due for Botox, and it hasn't kicked in yet. So my Botox now, yeah, thank you, Christy. My Botox now has not kicked in yet, but as you'll see, I can not move my forehead very well. And that's because I've had Botox for so long that muscle has weakened. And so I think that's fantastic. So now as Botoxless, and I can still make these angry lines and these little bunny lines in my little crow's feet. So I Botoxed all of those things today. I Botoxed my frowny muscles because nobody needs to frown. I Botoxed my dimpled chin. I do the lip flip thing, if you've heard about that. It makes your lips look a little bigger so you can't purse them. So I've injected Botox here. I didn't, one of my residents did today. I don't do it on myself. And then I've injected a little bit under the eyes to correct that squinty look. So in 1 week, I'm going to look much, much better. Oh, I also did my neck to help with these lines. So all of you out there are either thinking I'm a lunatic or brilliant, and I will tell you which I think that is. So, all right, Christy, back to the lecture. That's enough frightening me for today. Okay, yeah, let's see. Next, fillers. We talked a little bit about that. Let's skip over that. That was boring. Okay, and then lasers. You can really take some of the edge off of these deep wrinkles with lasers. A good deep laser will give you more downtime. So you will look redder and more irritated and have to stay home longer if it's a good laser. So nothing overnight is a quick fix. Anything that doesn't have downtime, doesn't make you red, and doesn't cost a lot is probably not that great of a laser. So our big deep lasers cost $1,200 for the whole face. And I try to do that once a year. I'll have the residents shoot me usually before Thanksgiving. That way I scare everyone in the Black Friday lines. So, but what can we do with products? So this is kind of your neck of the woods, and vitamin A creams. Retinol is a type of vitamin A. And so this is in the Voluform Night with retinol. And I really love the price point of retinol. This retinol, prescription strength retinols start at $65 a month. And so it's a very expensive product, but it does help collagen in the skin. And so it's very, very useful. When you tell patients or clients, to start using this, you may want to tell them to start out slowly, like once or twice a week, because retinols can be very drying, and really they should be. What they do is increase cellular turnover, which means you shed more yucky dead skin. So they have a nice exfoliating effect, and so it's good to tell clients that they can expect that with your good vitamin A creams. They train the skin to behave better, and it does take several months to work. And so to really act at the cellular level, they should take a few months to work. Anything that works immediately is probably just causing a moisturizing effect, which is lovely, but not long lasting. So vitamin A creams really do create a long lasting effect. Pregnant women should not use vitamin A creams. So tanning is like the great evil of the universe. It's a carcinogen, just like cigarettes are. Tanning before the age of 18 increases your melanoma risk by 85% and increases early onset melanoma by 41%. I have treated 2 vaginal melanomas in sunbed tanners. And boy, that's a mutilating surgery. It's very disturbing to do that to a young woman, and I don't ever want to do it again. So I think tanning is evil, and thank God minors are no longer allowed to tan in tanning beds due to government legislation. So I'm very thankful for that. But that is a picture of me, and I am as brown as that podium from tanning bed use. And so that's why I have to use all this Botox to make me look better, because I have done lots and lots and lots of damage to my skin. So no, not everyone who's 24 needs Botox, but probably anyone who roasted themselves in a tanning bed does. Okay, so let's talk some more about products. I love the products in your acne line. There are some really great things here. The only thing for acne safe in pregnancy is glycolic acid, and we'll talk about glycolic acid in a minute, but that is actually in your Radiant Peel that I love, 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 but I'll get to that in a moment. These other products are not safe in pregnancy: salicylic acid, the retinol, and benzoyl peroxide. And so you'll see that in your line, retinol is not in your acne line, but it is in the Voluform line. And so your patients, clients, may get some use out of the retinol products. So salicylic acid is wonderful. Benzoyl peroxide is wonderful. Benzoyl peroxide does bleach towels, and your product is for spot treatment, which is my favorite way to use benzoyl peroxide in the acne treatment gel. You just use it as needed when a spot comes up. But if people are applying it like all over their black back and then wearing a black shirt, they could bleach that shirt. So it's nice to be able to warn people about that. Anything good for acne is going to be drying, period. Just how it works. And then it can make you sun sensitive, and all of these products will. So important to use a good sunscreen. I do love this charcoal mask. We know that charcoal inhibits neutrophils, which is an inflammatory cell in the blood. And so we think this is how charcoal can benefit the skin. Okay. Resveratrol is anti-inflammatory, and this whole line has resveratrol in it, I think. Is that right, Christy? Are you in? This polyphenol resveratrol is a polyphenol, like many other good antioxidants. And so it helps fight cellular damage that is caused by the sun. I will tell you one other favorite thing that this product has in it is this vitamin B3. I love vitamin B3. It is so helpful for redness. So another name for it is nicotinamide or niacinamide. They're all kind of in the same family or chemical compound of vitamin B3. It is a wonderful product for your red sensitive patients. So think about this for your rosacea patients especially, or clients. I don't know if I'll ever say client for you, sorry. Okay, next. So vitamin C, really important for vitamin C to be packaged properly. And this Mary Kay product, the little squares that you dissolve in water, and it makes a serum in real time. So the problem with vitamin C is that it can get oxidized very easily. And so it breaks down pretty quickly if you don't have it in the right container. And so these wonderful squares are in these tiny packages, one by one. And so I love them for this. And so I think it's great. Then you have another Mary Kay serum you can put it with. And one of your serums has vitamin C, and the other has some pigment improving things like navy bean and algae peptides. Okay. So here are some things that I have loved more recently that Christy shared with me. The spinning, it used to be a spinning brush. Now it's a sonic brush like the Clarisonic. I love these brushes. I only use one once a day. That's about all the exfoliation you need. You only actually need to wash your face once a day. So you don't need to do the twice a day thing. If you have patients, clients who are being really dry, see if they're washing too much. They may be washing too much. I love Satin Lips. Green tea has antioxidant effects and is really wonderful. It can be an allergen, so if someone says they're allergic to it, they're not making it up. They really may be. The biocellulose masks are really nice. I use those when Christy shared them with me, and they're really fun. I love those vitamin C squares, the oil-free hydrating moisture. And what I've always loved since the very beginning when it came in like a pale pink tube is the Mary Kay concealer. There is nothing like it. That stuff is so wonderful. It does not settle in wrinkles, and it has a really nice cream base. So some of my favorite things. But, I wanted to talk about the glycolic peel. It's Radiant something. Christy, jump in. Radiance Peel, and it is wonderful. And this will be something that is safe in pregnancy. I would caution you to always tell patients to talk to their doctor, but between you, me, and the fence post, I'm going to tell them that glycolic acid is safe during pregnancy. And so I love, love, love that product. Christy gave me one when I did this talk 2 years ago, and I used it the whole time I was pregnant. It is fantastic. I do heavier glycolic acid peels in the office, so that's like a baby version of what we do in the office. And so I really love that product. I think it is absolutely worth the money. And I recommend it when patients want to do peels at home, especially like this time when people should be quarantining. It's good to stay home with that. So, and I love this lipstick. Thank you for this color, Christy. Good choice. Yeah, I like it.
You're so welcome. You wear it well, of course.
Thank you.
And I'm sorry that we didn't have a glycolic slide. I don't know why we didn't have a glycolic slide, but I know that is one of your favorites. And it's called the Revealing Radiance Facial Peel. And it is a very popular item. I love that women can get the benefits of glycolic in the privacy of their own home. And especially with the virus, we haven't been able to get out. So we have to do it at home, right?
That's right.
Dr. Sturgeon, your information was on point, fabulous. I know everybody enjoyed it. I have some questions for you. Would you take a few questions?
Oh, absolutely.
Okay. So I want to remind you guys that when you comment, you ask questions, anything like that, it's going to put you in the drawing for our door prizes. And I have 11 door prizes to give away tonight. Each of them are based around products that Dr. Sturgeon actually talked about tonight. So get excited about that. So let's start these questions. We have, first of all, from Tiffany Parsley. She says, should an oily girl cleanse twice a day, though? Should an oily girl?
I really wouldn't. You need to be drying them out with a product. So you should be using a product to dry them out. Like especially a retinol. Retinols are really useful for those dry patients. Salicylic acid can shrink oil glands, and so do the retinols. So these are useful things if you need to be drying them out with a product, I think. So I think there are some other nice mattifying things also in Mary Kay's line, if I'm not mistaken. So.
You are correct, yes. And the salicylic acid products group would be the blemish control toner, has salicylic acid in it, the clarifying cleanser from the Clear Proof line. And then we also have a salicylic acid serum, a pore purifying serum that has salicylic acid in it. And of course, you said the retinol, which is in the Repair Night Cream. Okay, good question. Let's go to our next question. From Jennifer Taylor, can women use retinol or vitamin A creams if they are breastfeeding?
Let me consult my, I can tell you that I did when I was breastfeeding, but it's not always the best thing to do. Doctors are not the best patients. Let me consult.
I did also, and my children turned out just fine.
I think yes. The reason retinols are not safe during pregnancy is because they can affect the neural tube development, which is the part that develops the baby's brain. Lactation may use while breastfeeding. No human data available, the low risk of infant harm. And so babies can get extra vitamin A. Actually, one of the main differences before DHA became popular in prenatal vitamins, the only difference between prenatal vitamins and regular vitamins is that they had extra folic acid and no vitamin A. And so after babies are born, they can ingest vitamin A. It's very good for them. And so a diet high in vitamin A may be useful while breastfeeding. So I don't think the cream has any danger at all.
Very good. Awesome. Okay, let's see what our next question is. Next question is about skin tags. How, if you don't want to go see a dermatologist, can you cut off your own skin tag? Is that dangerous?
I actually do tell patients to do this. And so I would say if it's a straightforward skin tag, absolutely. If it looks like a classic textbook skin tag, yes. I recommend that people like nip them with cuticle scissors or nail clippers. They'll bleed a little, but you won't bleed to death. That's fine. And the only thing that I would caution is if you're not 100% sure it's a skin tag, please don't. I had a patient when I was an intern who died from melanoma because he used this product that he thought was like, it was kind of like a tag away product, and he thought it was a skin tag, but it was melanoma. And so I would just say, yeah, with the caveat that, yeah, if your doctor, like your primary doctor tells you it's a skin tag, yes, you bet, go for it, do it yourself. Our clinic charges $50 for 5 of them. So I think that's pretty reasonable. And I think $150 for 15. So, if you have a question, I'd say just be darn sure that it is a skin tag before you start working on it. But absolutely, yes. I tell my patients to do it all the time to save a few bucks because I'm pretty thrifty. So I try not to, even though I spend a lot on Botox, I try to save it elsewhere.
Awesome. So speaking of Botox, is Lubbock now, are our offices now open and it's okay to go in? Essential is now over, we can go in?
And Botox is so essential. I have always felt like it was so. But in fact, that's why I waited till today. I was quite out of Botox, as you can tell, but I wanted to be a good example. And even though I can do it whenever I want to, I didn't want to do an elective procedure until they were really safe to do.
I think what I like best about what you said, the first time I ever heard you speak at our women's club that we were both a part of with the bank, was that Botox is preventative and it keeps that muscle from moving. And so we love that Mary Kay has great skincare to take care of the skin. But if someone wants a little Botox to keep that muscle from moving, go for it, right?
Absolutely. I think that's the important thing is you're only going to get so far with a product. Do you need good products? Absolutely. Can you truly erase a wrinkle with a product? Probably not so much. And if you promise people that, they're probably not going to come back to you and buy more. So I think it's all about setting expectations, because if you're completely honest with someone, and you would never intentionally mislead someone, but sometimes clinical studies can be a little bit misleading, and the before and after photos for the Mary Kay products are very honest. But a lot of it is just that wrinkles have to be surgically removed one way or another, at least with Botox or fillers.
Great answer. Great answer. Okay. I have from Valerie, I think this is a question. My face is usually oily. Oh, it popped up. Where'd it go? My face is usually oily, but when the weather changes, my face dries up, and anything I put on it burns it, and nothing helps to hydrate it.
Yes.
So Valerie has that dry skin from her oiliness. I do know that oil-free hydrating gel that you like so much is a good choice. What are your thoughts on that?
So a lot of times when people just get so sensitive they can't put anything on there, it's risky, because the only thing that will really help is an ointment base or a grease, like that stuff that my dad's addicted to. That wasn't on my love list, but it is on my love list.
The extra unmoist night cream.
Yeah. Like my dad just slathers that on his face, which will really cause acne. So, use caution. But one thing that I really recommend for patients like that are, you can use anything if you can get enough moisture in the air. And so you can use a retinol even in the winter, but you have to run a humidifier. So I run a humidifier next to my bed at night, and that usually will fix the problem. And so if it's a weather related thing, fix the weather. That way you can keep using your products. I do have to go to a lighter retinol regimen in the winter. I do use a prescription strength in the summer, but sometimes I just use an over-the-counter strength, like your Mary Kay Voluform night cream would be great for that in the winter for some of the more sensitive patients like myself.
Wonderful. Now you mentioned the humidifier. What about drinking water? Does it really make a difference in how your skin looks?
Well, we think so. One of the filler gurus that taught me always said that hydrate really well so that hyaluronic acid will have all the water to suck up. And so we do know that people seem to do better with lots of moisture in hydrating. And you can overhydrate, but that's pretty uncommon. And so I think it's a good thing to drink your 8 glasses a day, is what some people say. I've heard so many things, and I don't really know what's true. But listen to your body. I think we as women just kind of go through and do all of our things. And I will go through a half day and realize that I've had nothing but a cup of coffee, and that's probably not enough to keep my skin looking good.
I've been there. Oh, and it causes me to have headaches too.
It's so
Crazy. Okay, let's see. Any suggestions for stubborn, dark acne spots? Previously used Accutane for adult acne.
Yes. So what you'll want is a vitamin C product and a retinol. And so those are 2 things that can really help with pigment issues. I think those are really useful. I don't know that much about the navy bean stuff, to be honest, but that isn't some of your products, and it seems like the pictures are pretty good. So it might be worth a try, but I know vitamin A at night and vitamin C in the morning will really help those scars to fade. The most important thing you can do is sunscreen, because sun makes those scars look so much darker than they need to be, because they tan more easily than the normal skin. And so lots and lots and lots of sun protection is just absolutely paramount in those dark scars. And I feel you, because they are so hard to get rid of. But they do fade eventually. And so lots of patience and lots of sunscreen, and really physical protection. A hat, covering whenever you can is really, really useful.
And I can attest to that. I had horrible sunspots right in here, and I hardly noticed them. They're not completely gone, but I hardly noticed them because I worked very hard to keep them covered and keep that hat on and keep using products like retinol and the navy bean extract to begin to lighten them. So it does take a while, but it does happen. So
it does work. It does work. That's right.
Okay, let's see. I had another one here. How can you tell the difference between the crusty barnacles and the one that is precancerous?
Boy, sometimes it takes 4 years of med school, 4 years of residency, and 9 years of experience. So they can be really tricky and look a lot alike. A lot of my patients who've had both get used to them, and they're like, oh yes, it's just a barnacle, or no, I've got one of those precancers here. And so sometimes it just takes experience. The actual difference between them is that the actinic keratosis, the precancer, is arising from within the skin, and then the seborrheic keratosis also arises within the skin, but higher up, and so it looks more stuck on than the others. Like like the precancers, you might want to scrape them off like this, but the others look like more stuck on like glue.
Gotcha. Good answer. Good question.
Good question.
Okay, I have another question, and it makes me think I thought of something earlier when you mentioned the navy bean might be worth a try for those acne spots. I'll remind all of our viewers that with Mary Kay products, we love that we have 100% satisfaction guarantee. And Mary Kay takes care of your beauty consultant so that she can take care of you. So if you think, I think I'll try that navy bean extract product. I think I'll try that retinol product. I want you to know that if you're not satisfied with it, we want to know about it, and we will make sure and trade it out for something different or give you your money back. So don't ever be afraid to just try something. Sometimes it's a little bit of trial and error, in my opinion. I know I had a client once that later became a beauty consultant that had just the trickiest skin, and we just had to try things and switch it out until we found the best custom suggestion mix for her. So keep that in mind, everybody. Okay, I'm going to take this as our last question, and then we are going to, I see two good ones, and then we're going to do door prizes. So from Jackie has lupus, or no, she doesn't have lupus. She says, if people have lupus, what Mary Kay products would you try that would cause them to break out? I think she means wouldn't.
Right.
Natural products. Mary Kay does have a natural line. You don't probably even know this, Dr. Sturgeon, unless you saw it in the lookbook. Brand new as of August. We're very proud of that for people who like a natural line. But tell us about lupus and skincare and breaking out. And you may not know the right Mary Kay product, but what are your thoughts on that?
All of them are going to be fine. Lupus patients are not necessarily any more sensitive to anything than other patients. I will tell you that products may make them more sensitive to the sun, and lupus patients are sensitive to the sun already, like a retinol. But honestly, lupus patients need that retinol because it really helps with scarring. And so they just need to be very aggressive about their sun protection. So they've got to push the sunscreen and lots of physical protection. They need to be wearing hats, and they really need to not be going in the sun. And so those were some of the patients that I was talking about earlier. Like, we have lupus patients and we check their vitamin D level and they're fine because they're taking calcium and vitamin D. But that's an aside. But honestly, any of the products should be fine. Just know that they may have more irritation in the skin, maybe a bit more sensitive, but I don't think there's anything that would be off limits by any means. And some things may even be helpful, like the vitamin C products and retinols.
Awesome. And again, that trial and error, try things and switch it out with your beauty consultant. Okay, last question. What would you suggest for razor burn bumps?
Oh, yes. I do like benzoyl peroxide, and I love retinol. Benzoyl peroxide in an acne spot treatment is really useful after they pop up. But to prevent them from happening, using a retinol every day can help the skin not build up so much. Remember, I talked about the retinol being kind of a gentle exfoliator where it peels off some of that skin, helps increase the cell turnover. Razor bumps happen when skin grows over the hair and then bacteria get inside. And that's why the benzoyl peroxide, which is antibacterial, is helpful. And then the retinol helps the skin grow better. So after a few months of retinol use, people will see improvement with the razor bumps.
Great answer. And I said that was the last one, but I see another good one. Can retinol help acne scars? And what about cystic acne?
Absolutely. I love retinol for acne scarring. That's what I do for a lot of patients who choose not to do acne scarring treatment like lasers or microneedling in the office or can't spend the money on them because they can be quite expensive to do all these laser treatments. And so I always have those patients on a retinol, absolutely. And cystic acne usually requires medication. It usually requires medication orally, like antibiotics, Accutane. Another drug can be useful. Hormonal medicines like birth controls can be useful. Certain kinds of birth controls, your doctor will know which one in women. And so we use them not as birth control, but actually it's hormonal therapy to help with acne. And so cystic acne can scar and really needs oral treatment of some sort. And so if you see a patient that really is trying to treat their cystic acne with topical medicines, they need those topical medicines. Absolutely. They need the sal acid. They need the BPO, the benzoyl peroxide. They need the retinol, but they need a doctor, and they need something internally to help with that. And so I would definitely send them our way. So our fellow clinic is staffed with board certified dermatologists, and they have like immediate availability within the next month or two. And so that's the great thing is we have one fellow a year who is doing extra surgical training with me to be a skin cancer expert. But they have a clinic on Friday afternoons to help our patients get in.
And so how do they contact that clinic? And if I know you're busier than they are, but if they wanted to try to get in to see you, how would they find you and the fellows that are at the clinic?
I would call the Texas Tech Physicians Dermatology Department, and our number, if you want to get a pen, I will give to you. But you can call us and ask for the next available appointment, and they will offer that fellow clinic to you very quickly. And our fellows are very good. My fellow injected my Botox some today, so I let them all work on me and my family members, I should say, my family members and I, all are taken care of by residents, training in dermatology and my fellow training in surgical expertise. But our clinic number is 806-743-1842. We are also doing telemedicine. If you don't think you have a skin cancer but want assistance with things like acne or eczema, that is perfect for telemedicine. We can do that now, and we have immediate availability for that as well.
Wonderful. I put that in the chat box where they could see that phone number. Okay. So y'all, this information has been so great. I know that you are, if you could speak right now, you would say a million thank yous and appreciation to Dr. Ashley Sturgeon. Isn't she lovely? Have I just told y'all she is just the loveliest person? And so I know if you need to see her or anyone that she has trained, I know that you will be in great hands. And so I just encourage you to know about seeing a doctor. And you mentioned the cystic acne and seeing a doctor. I want you to know that I had cystic acne, and I was a tetracycline girl first and then went all the way to Accutane. And y'all, it does. It works. You eventually can get rid of it. And so I think that's so important for our beauty consultants to know. If you're sitting across the table from a client, yes, the Clear Proof acne line is phenomenal, but sometimes they need that oral medication. And I know that. And I know the topical's great, but send them over to a great dermatologist to get that oral medication as well. And they'll thank you because you did the right thing to send them the right way. So we appreciate you so much. We're going to give away some door prizes now. So my daughter Madison's going to tell me who won them. What she did, I told her to take comments 10, 20, 30, number 40, number 50, all the way to comment number 110 and tell us who those winners were. Madison, do you have them ready? You need my assistance. With what? Okay, so bring them over. Who we have. Who do we have? We'll start with who we have. And then we may have to go back and figure out the ones. If you did not comment what your name was or let StreamYard tell us who you were, we may not know who you are. It just says Facebook user. And so we may have to go back and do some of them later. But let me show you my screen and tell you our here are the things that we're going to give away tonight. So the first thing we're going to give away tonight is going to be to a Facebook user. So we're going to have to go back and see who the number 10 Facebook user was. And we're going to have to let you know. She was, okay. And it is the Ashley's favorite product, the Revealing Radiance Facial Peel, the glycolic facial peel. So a couple of times a week you can use this. We're going to have to find out who that winner is. But number 10 Facebook user, we will find out who you are and we will get that to you. Congratulations. That's a $70 product. So yay you. Okay, the next winner is going to get the next one. It's the Replenishing Serum Plus C. And we know this winner. It's Stephanie Goldston. So we talked a lot about vitamin C tonight for collagen, for scarring. Vitamin C is amazing. Everybody can benefit from vitamin C. And so Stephanie, congratulations. If you want Stephanie to go ahead and tell me in the comments who your beauty consultant is, I will make sure that you get that. If you are a beauty consultant, let me know that too. And then we will arrange for one of your customers to receive this free product. All of these free products are intended for customers and guests, okay? All right, our next one is going to be another Facebook user, unfortunately, the vitamin C squares. Whoever that secret person is going to get the vitamin C squares, a pack of these to mix with water to make your vitamin C serum, and then mix it with your favorite Mary Kay serum for a wonderful vitamin C treatment. It's a powerhouse. So congratulations. We will find out who that person is. Okay, that one is a repeat. So Leanna Davis is our next one. Let me make sure and write these down. Vitamin C squares here, peel here. What did Stephanie get? The serum? Okay. Yeah. Okay. So Leanna Davis is going to get our next one. And Leanna Davis, she's going to get the Voluform lifting mask. Oh my goodness. These are so much fun. The Voluform lifting mask is a sheet mask. So there's one sheet in here, Leanna. You peel it out and you put it on your face. It has the eye holes and the nose hole and the mouth hole. And it gives you a wonderful serum of lifting that you can relax and pamper yourself and have some downtime. So okay, so congratulations, Leanna. That's the lifting mask. And Stephanie's going to give it to her mother. Congratulations, Mom. Mom is watching as well, so congratulations. Okay, the other gifts, we're going to have to figure out who they are because of Facebook users, but we will figure it out. So let me tell you what the next people are going to win and give you a little product commercial for these. The TimeWise 3D Day Cream with SPF 30. Dr. Sturgeon talked a lot about SPF. Remember, this is a part of our Miracle Set line that has the resveratrol in it and the vitamin B3. And there's a formula for oily to combination and normal to dry skin. We love this skincare line for women who are facing early to moderate signs of aging. And so even if you didn't win it, that might be something you want to ask your beauty consultant about. Our next product is going to be the Mary Kay Sunscreen SPF 50. Let me give a fun plug for this wonderful sunscreen for a moment. Just today, I had 2 testimonials, just this very day. I have a wonderful lady who helps me with gardening. She's a more mature woman. And last week when she was gardening, she was rubbing her eyes. And I said, "Oh, Kathy, what's wrong?" And she said, "My sunscreen always gets in my eyes. And I just am beginning to think it's not even worth wearing it anymore." And I said, "Oh, Kathy, everybody tells me that the Mary Kay sunscreen does not do that. Why don't I give you a bottle?" So today when she was here gardening, she said, "I love the sunscreen and there's not a thing in my eyes. It is amazing." So there's a nice plug for that. And then the owner of the cakery right here in Lubbock, it's a wonderful bakery. Go see them for some yummy cupcakes and treats. They have a new sliding glass door in their new driveway location, and she is being blistered by the sun. And she said, "There is no better sunscreen than the Mary Kay sunscreen. I need one." So there's a little plug for that. We love that. Next, someone's going to win the Mary Kay Sunscreen Lip Balm with SPF 15 to protect those lips. So just so you know, we have lip balm too with sunscreen. And next, because we don't want to be in the sun, Dr. Sturgeon was very clear on that, and I give her an amen on that. We have the Mary Kay Sunless Gradual Tanning Lotion. It smells very nice. All sunless tanners have a little bit of a strange scent after it oxidizes on your skin, but it smells very nice with a vanilla scent, and it gradually tans your skin so you don't go from being white today and orange tomorrow.
I have tried them all. This is absolutely the best smelling one for sure.
Isn't it awesome? And so we got to have some color, you guys. We've got to have some color. So know that that is something that you can ask your Mary Kay consultant about. Our next door prize will be the Mary Kay After Sun Replenishing Gel, because it is Skin Cancer Awareness Month. And we know you might be out in the sun some with your sunscreen on. After you get out of the sun, this wonderful, nourishing, moisturizing gel is the perfect addition after you get out of the sun or out of the pool. We have customers that rave about it, and you may not have even known we had it, customers. So ask your beauty consultant about that. And the very last door prize that I'm giving away tonight is the MK Men Hydrating Lotion. It's a moisturizer for your man, and it also has an SPF of 30 because he needs to wear sunscreen too. He really does. So tell him you talked to Dr. Sturgeon today, and she insists that he wear some sunscreen, and get him an MK Men facial hydrator with sunscreen. Oh, that was so much fun. We will figure out who those door prize winners are based on those comments. Friends that have been watching, I thank you for your time tonight. I know you could be doing a million things on a Wednesday night, and I thank you for joining us. And I thank you for giving Ashley such great questions and great comments and great love. So, Ashley, we appreciate you, and we thank you for.
Yeah, thanks for having me.
Good night, everybody.